Do you test the patient for HbA1c?
Oh, hemoglobin A1C.
Yeah. How do you call it in
hemoglobin A1C? Okay. So Maria's question was, do you test the patient for hemoglobin A1C? Yes, we do. And it's part of what's ordered by the physician. Yes, yes, you're absolutely right. So she said that, you know, when you have the hemoglobin A1C level, maybe you can look back to see what the history of that is and to see if she was taking her insulin or not. Well, actually, hemoglobin A1C shows if they have been compliant and how high their blood sugars have been. Not necessarily if they've been taking, it could. Right.
The level is not...
yes.
Above normal.
Above normal.
Sure she was not taking her insulin correctly.
Or, you know, it's hard to say you haven't been taking your insulin, because who knows if there have been infections along the way too that could have made her insulin requirements higher than what she was actually prescribed. Okay. So that can play into that too. But you're right. It is important to look at the hemoglobin A1C level, because that can tell us how high their blood sugars have been over the past 3 months. But it could be for many various reasons. Sometimes it could just be non-compliance too with diet and insulin. So.
And could be Atkins diet related to her ketoacidosis, because
that's a good point. She said it could be related to the Atkins diet. It could be.
Because of the lipids? The high lipids in the diet?
The high lipids, not that it would affect the hemoglobin A1C, but...
No, affecting the keto acids.
Oh, I see what you mean. Yeah. Oh, okay. Yeah. That makes sense. So if she was following, yes, good thinking, putting 2 and 2 together. If she was following the Atkins diet to a T, and she was breaking down fatty acids, and then it could have it could have all played in together that she was having that too. So that would be an interesting case study to look into further. So, good point.
But a type 1 diabetic isn't taught how to, or isn't required to see a physician every 3 months or every 6 months just to monitor the glucose level and.
So, okay, are you asking a question or making a statement?
A type 1 diabetic is required to see a physician regularly, on a regular basis, just to see if the blood sugar level is normal, to see if it...
Well, I know that they are, especially the first few years of being diagnosed. I don't know, Jessie, if you know of any other lifetime.
Required is an interesting word.
Exactly.
The recommendation for diabetes, it certainly would be that they would have regular checkups with their physicians to monitor what their blood sugar is doing and adjustment for medication. But oftentimes, and perhaps with this case, you will get somebody coming into our hospital that has not seen a physician for a number of reasons. And remember, in the United States, our insurance and healthcare system at this point in time is so different. If you don't have healthcare insurance that you've paid for, you may choose to not go to the doctor and choose to buy food because you don't have enough money anyway, or to buy your insulin and just not go to the doctor because it isn't free, it's going to be a charge. And that's a whole issue in our country, is that health disparity when it's economically driven. And there are patients who just don't want to go because perhaps they haven't followed the recommendation, and I don't want somebody to tell me that I did something wrong, or they think they're doing just fine and it sneaks up on them. It required, doesn't really work in our country.
Yeah. Exactly. That's true.
Yeah. Oh, it would be nice.
What do you follow your patients in your area of practice? Do you have individual groups, or do you have workshop like we do with the diabetic patients, for example, or obese patients? Have you groups? Workshop?
Yeah. All of those things. So the question is it individual, is it group, is it a workshop? All of those things. Individual is probably more common, but when we're talking about diabetes, diabetes self-management and training is a group, oftentimes a group instruction over a 12-week course of time. But we do require, in order to get payment for our services from our government in renal disease or diabetes, that referral comes from the physician, either to a group class or to an individual. I think we do probably more individual than groups in the United States. But as we move forward in trying to manage all the patients, we need to be much more creative in our approaches and do more groups.
Aș vrea să întreb cine stabilește cantitatea de glucide, medicul sau dieteticianul în dietă?
Physician or the dietitian?
Okay, the question is who sets the level of the carbohydrates that the patient, yeah. So the dietitian does. Mm-hmm. Yeah, so like depending also on what the insulin program is, the amount of insulin that the patient is supposed to take, then we have to match that too when it comes to the carbohydrate counting method, if that's a method that we go with for the patient. Maria's question is, what is the percentage of carbohydrates from the whole total caloric intake for the day? It's supposed to be anywhere between 55 to 60. And I saw one textbook that even said 65, but that scares me to say 65. So 55 to 60. Is that what you would usually do? Okay, 50 to 60. Okay. The question is, what is a clear liquid diet?
At Loma Linda.
At Loma Linda?
Yeah, because
okay.
we were told that the first few days it's 0 protein, 0 lipids.
For a clear liquid diet?
No, for ketoacidosis diabetic.
We don't have a specific clear liquid diet for ketoacidosis.
No, we have a 0 protein, 0 lipid diet.
For clear liquids. Our clear liquid diet basically is just that. It doesn't really have any protein. Yeah. And so the only protein that we would have is if we added a supplemental drink like Resource Breeze, and that has protein, but usually clear liquids like apple juice, broths, they don't really have protein in them. Okay. So it's just to start them off, just to see if they're able to tolerate things slowly back before we get them onto a regular diet. So, yeah. So we don't have like a rule as far as clear liquids. There are various levels of clear liquids, but you might be thinking that there's a clear liquid diet, then there's a full liquid diet, and soft, and then regular. Is that what you might be thinking? Or no, you were just asking about the different levels. Yeah. At least in my hospital, we don't have levels. Yeah. And Jessie said no either, so.
Nu mai sunt întrebări? Ok. Where is Dr. Dan? We can continue, Miss Anne? Okay. Allow me to invite Miss Anne Looy to start a discussion regarding all we discussed this morning to practice. And I think you will be very interested in that. Deci vom discuta despre practica de dieteticianului, să spunem, supravegheată, ce s-a discutat dimineață, subiectele de dimineață, sorry. You will stay there? Yeah. Oh, okay.
I'm going to start this debate. What? Oh, thank you. How kind. I'm going to start this debate because I know that the audience are very interested to know where their placements are going to be. Is that correct, audience? Okay. We have experts here. We have experts, and I am going to ask each expert 2 questions. And I'm going to then pass the microphone. Now, these are the questions that I think you might be interested in. Then you can ask questions, okay? My first question is, we know that Romania does not have many dietitians working in hospitals. We know that Romania does not have many dietitians working anywhere. So if we are to find you placements, we have to be very creative, do we not? Aha. Now, Ethan, Jessie, shall I involve you, Karen? No? You might help me out here. You knew about that? Okay, you might be able to. Therese, why not? Why not? Okay. Bert, JeJe. If you were in the Romanian situation, where would you find placements for your students and how? So we heard from various speakers that we could use placements in industry, we could use placements in private practice, we could, etc., etc. So we know it's possible. We want to know how. Agreed? And not only do we want to know how, but we also want to know what would you learn in a place like that. That's a good question. Can I ask that question of all of the speakers and a few more besides? So be creative, please. Who shall we ask first? Oh, Jessie's going to step up here.
It's because I think if I start it, someone else can finish it and improve upon this idea. I don't know exactly what will work. I don't think any of us do. And it's my perception that trying to break into hospitals is what maybe is where people want to go. Hospitals, is that, I mean, what would be the bet for the profession in Romania? Where would be the ideal place to get more training so that you could have impact care? Hospitals? Okay. So, universities, where's Dr. Dan go? There you are. At the university here in Tucumirish, what is the relationship like with the hospitals that in town?
I think Monica.
Monica,
yes,
okay.
Yes, I know.
Because I would find a champion or someone within those systems at a level enough to make something happen to start a discussion with. So I'm not answering your question. I'm asking another one. It is my style. But is there a possibility that you have a relationship?
With hospital, we have a good collaboration because most of them are a clinical type,
yes,
university type of hospitals. So our students are learning in the hospitals. Okay. The problem or the weakness is our doctors are not teaching enough dietetics or nutrition stuff. More treatment or diagnosis or something like this.
And could the faculty from the university get a special privileging to go into those hospitals and start in combination with those doctors seeing patients that then that dietetic expertise could then be interjected? And it's just a thought I had as we were going through the day.
Maybe in time.
Maybe in time. Well, I don't think it's easy.
Yeah.
But it seems if we've got some champion in a hospital can start there, or is there some practice? Where's
The other colleagues help me. Where's
Michael?
Alexander?
He can work more than just at the clinic. You've got some dietitians in clinic practice too, to put students with, but maybe he can develop a relationship in the hospital too. So I don't know. Okay, see, I'm starting, so I don't know the answers.
Okay. Okay. So
find out where those.
So the idea is that we find the people that are most receptive in the hospitals, and that some faculty staff from the university or student graduates go in to work with the hospital staff to teach, to help the staff teach dietetics.
We have to find a way to motivate them to help us.
Okay.
And reverse.
One
Yes,
idea. Thank you. We have Ethan volunteering with another idea.
And I think probably the solution to this is multifactorial, many solutions to come up with something that's going to work. But thank you. Okay, and I will. Let's see, what was it now? You're going to need to build up your workforce of dietitians in Romania. And to do that, it's going to take several ways. The one that Jessie suggests, I think, is a really good one. But another one I think you could explore is to look for placements in other countries for your dietitians in training for the supervised practice. And some of the individuals might be able to go to other countries with, maybe in Europe, maybe even in the U.S. if the language isn't a barrier, and get the training at that hospital, come back and create a position here in Romania, and then those individuals can be the workforce that would be the preceptors for the subsequent generation of dietitians that are seeking supervised practice. Again, I think that's only a part of the solution, but it could be a way to start building up your registered dietitian workforce in Romania.
Thank you. It could well be, but I think that my understanding across all the associations in EFAD is similar to the status that was suggested earlier in the States, that there are not enough placements in the home countries to satisfy the home students, so it would be really difficult to find additional. But it's a good idea. We'll take that one anyway. Right. Marsha.
Well, something I heard, and I don't know what the numbers are, but I understand there's at least a couple of physicians who've been taking the training to be dietitians as well, and therefore have connections with the health system and can easily combine their knowledge of medicine and medical practice and nutrition therapy to put them together to be a core to start some placement in hospitals. So I think that exists in your country, and you could maybe build on that and provide some support to those people to start. And some of the ways to have more students go through is to think about the approach to education with groups of students in self-directed learning models, so that groups are learning together and the supervisor is checking in at stages and providing advice as opposed to one-on-one. That's a very intensive approach to education. So I think you can multiply your effect with different models of education. And we know in medical education and other places, self-directed learning models work very well. Students are very creative at finding solutions, evaluating themselves, critiquing themselves as a group, and so on. So building on that might help. And I think there's lots of online resources that students can use in that process as well. And I think there might be even another idea. I haven't explored it, but as I've been working around the world, I often get the question in Canada and abroad, is there any opportunity for exchange? Do we have any opportunity to be involved in something in a different country? And so instead of considering your students going to Canada to learn to practice dietetics in a Romanian health system, very different than ours, there might be some experienced practitioners who have got a variety of experiences that would be prepared and interested, in fact excited, to come to your country and take on working with a group of students within your setting to help build up that capacity. And I think we could find people that would be very interested to do that.
Thank you, Marsha. I think that's a really good idea. And if I can just say that in Britain, because we don't have enough places, we are using that kind of peer learning model. We teach our dietitians how to run that. So they have a group of students, but they have to be taught how to handle it because it has to be a very purposeful method of teaching. There's a lot of what we call front loading, a lot of preparation that has to go on. And I think you're right, there will be teachers who can work in the hospital as practicing dietitians who can model those. Aha, Marsha's coming back for a second bite. Oh, gee, are you getting jealous?
I just want to build on your idea. A connection, networking, how we think when we network all the time. So there are other places in the world, and one that comes to my mind, don't have firsthand experience there, but I do know the educators who've been involved. So developing this approach in dietetics, practicum education, has been fully elaborated in Australia. And I'm sure they'd be willing to share with the academic community here. And maybe elsewhere in Europe, I just don't know.
Yeah, well, I've already suggested to Dr. Dan that we could send somebody over from England to teach. JeJe, were you the next in line?
I'm actually just being a mouthpiece, a messenger for a little bird that just whispered something to me. Okay, so the idea was that one of their teachers, in Timishara, is that the name, am I saying that correctly, is working already in a hospital. And so if that teacher can start taking them into the hospital themselves, they would really appreciate it. They just don't want to say anything right now because they haven't taken their major exam yet, something like that. So they're afraid to say anything at this time. So Dr. Dan, if you can pass on that message to that particular teacher, they would greatly appreciate it.
I'm going to have it, yeah. I think the program should build a really strong alumni association. So everybody that graduates from this program is eventually, hopefully, going to have a job. And you need to know where those people are and where they're working. And when you first have a small group, you know that. You know you keep, but the group keeps growing and you lose touch. So I would suggest that you find ways to keep in touch with your alumni, because as they go out and work and they're out working a year or two, all of a sudden you have people you can tap who first of all might know some administrative angles of how to get in touch with people in institutions you might want to work with, and secondly they now are the experienced practitioner, but you must keep in touch with them. So that's an idea.
And that could be a requirement. If you graduate from this course, you must find at least one placement for people who are coming next. Do you understand what I mean? Right. Pauline wanted to have something.
I'm turning things round slightly in that the rector was here yesterday and has been very involved and influential in the course. And I think sometimes as well as having your own champions and your champions and physicians, it can be very good to use someone at a much higher level to work with his peers, with his colleagues at a higher level in the hospital, and the president, and actually saying, this is what, you know, there's a requirement here, this is needed for the health and the well-being of the population. So I think you've got to go up as well as working at your own level. And Dr. Dan, sorry, I know I'm looking at you to try and drive some of those areas as well. the other thing that personally I find very, very powerful is that there was what we called an agreement between all of our hospital chiefs, our university chiefs, and our Department of Health chiefs. And my job, that's where my job came from, was because they decided the university needed someone like me who trained the people out in the hospitals. I go into hospitals, I train the dietitians there so that they know what they have got to do with the students that come out to them. I also train the students so that hopefully we match and we merge, that the training and professional practice and assignment and assessment is mirrored in both areas. But that was coming from a very high up agreement. So again, I think that is something that again puts more pressure and more promotional aspects onto the role of the dietitian.
Okay, I'm going to just build on that a little bit, if you don't mind, Bert, first of all. We want our doctors in UK to be well informed about nutrition. We have already heard that the doctors do not get a great deal of information, and I do not know what the situation is in Romania, but generally they do not. Our medical school has been very creative because what they encourage is pairing. So we get a physician student and a dietetic student working together, exchanging information, seeing a patient, presenting the case study back. And that way we look at the understanding that the doctors have about nutrition, but that's what we bring, and the understanding about medicine and condition and therapy, and that's what they bring. So that's an up. Let's have a lot of collaboration. Why not have some pairing and working alongside the physicians? Because I bet they have placements. Do you think? Bert.
I was going to say something along that line. I'd like to begin by looking at what nursing is doing in this area in terms of their placement. But I think that we also need to do something in the area of marketing. Not an overt program of marketing, but creating an undertow of need and providing services that, we're not going out and overtly saying, we can do this, but helping the physician, helping the nurse practitioner, the nurses, and providing that information that they have not had necessarily before. And they say, oh, we need this, we can use it. And as a result of that, I think that's going to help us to get in. And I would begin this very, very early in the curriculum so that the students are modeling this with the professionals so that they grow up together professionally.
So actually using things like nursing and medical students and their placements to help you do joint placements and make it an absolutely premeditated, planned placement. Therese?
I agree entirely with you because I told this, to Monica just 1 hour before. We are dietitians, you are dietitians, but who knows who is a dietitian? So you must explain it, you must create, if you want the job, you must stress on the need. If they can answer the need, so they create the job. It's the first thing to do, is to create the need.
Okay, that's good. We have some ideas there. But I'm going to now up the question. All right? So now the question is, we have some placements, but we still don't have enough. So I want us to think about being creative outside the hospital situation. Who will we use and what will we ask them to provide? Because there may not be a dietitian in that environment. There may not be a dietitian there. But remember, dietitians obviously need to know about dietetics and its application, but we also need to know about communication. We also need to know about food service. We need to know about management. We need to know many other things which we can then take back into our dietetics. So let us now go round again and be creative. Where else can we go, and what do we need to tell the people where we're going to put the student that they need to help the student with? And we have an audience member first. So I'm going to the audience member. I've always wanted to do this. It's like a talk program, isn't it? Yes. Yes. You have the floor.
Thank you. I don't know, I don't want to be misunderstood, but I want to say some words, and after to ask you and the other friends, where they have experience, they have their experience, you have your experience in your countries, but think a little bit about one fact here in Romania. We were under the communist government. The communist government failed. And the person who started to teach democracy and the leaders of the new, how can I say, free parties in Romania were the former communist leaders. Even the next president after Ceausescu, he was a former communist leader. Now I put this as ideas. Here I see in the Romanian, or not, we speak about the Romanian health system, the physician, they try to do the best, even in the past, even today. And I don't think that today they don't want to be the best, and they are the best, because they save hundreds of lives, maybe every day in all the countries. But on the other hand, there are a lot of problems which we should recognize that they exist. And instead of resolving this, the government is starting to close the hospitals. How do you believe, this is the question, how do you believe that in all this jungle, the government will accept with the easy way a new profession, and was somebody asked without name, that why it's not willing to help us? It's not possible. How do you believe that a physician could help against the government decision to create something? It's not possible. Even you have if you have a position in a hospital staff, you cannot force the government to accept a new profession. And now, in all this, how can we have the future, a clear future? Thank you very much.
Thank you. This is a very good point. And of course, we have to work within the ministries of health and the ministries of education. We have to do that. But it is possible to change. And I think one of the things that, being in the European Union, pressure is growing, and governments are really, really concerned about the economic prosperity of the country. And we understand that obesity is growing, diabetes, and all of these things we can make a difference to, and we can save money, and that is our particular point, that we can be successful, and that's why we need the evidence. So I think you're right, it won't happen quickly, but look what's happened in the States, look what happened in other countries, and France. We have exactly the same problems you have here. Do not be disappointed if you cannot get there next year. Have a vision. have a long-term plan. You're right, not sure.
Yeah. Yeah,
sorry.
I have one. Thank you.
You have one.
That's
you want
sufficient
two?
for me. Yeah. Yeah. And I'm here to tell you that dietitians exist outside hospital. For the first time, 5 years ago, I made an intervention in a public with public, all audiences public. I saw many physicians, and they told me, how can we be outside hospital? But yes, we can work with children at school, we can help pregnant women, we can help patients when they go outside hospital. There are no dietitians, okay? I work in sports nutrition. Nutrition is made in sports by sportsmen. Is it good for you? Not for me. I can speak about patient meetings, for example. You can make meetings with multidisciplinary, with a psychologist, with a physiotherapist, with nurses, with anything, other health professional. You can spread outside hospital. You have a place to be, not only in hospital. Think about it, because I work outside hospital for near 15 years now, and it works.
I only want to say, first of all, I don't think at this point we have to blame everything on the communists. I think that's gone by. The generation that is now here doesn't still remember, it doesn't still live then. For the second thing that...
Carry on. Carry on.
I don't say we should forget that it happened, but I don't think we should blame something on it.
We need to look to the future.
Of course. About the idea that we should wait for the government to do something, I don't think it will ever happen.
No.
And I think the major role of this association that was born now is to implement the role of the dietitian in the country. And the first step that must be done is that the persons graduating for the first years should find a placement, probably in a hospital, because it's the only, or in maybe a center for dialysis or a center for diabetes, because are the sole places that have a experience with prescribing a diet, or in a pediatric office, and to gather first some experience. I think by staying there, I assume in 1 year, a person can gather an experience, maybe in a field, maybe not in the entire pathology. And I think the second step should be that these persons graduating last year are learning for the next year and will be teaching from now on.
Yes, it will grow.
And this is the only way that it can happen for a new profession to develop in this country.
Good. Yes, I agree, it will grow. But can I just go round and ask now, creative placement outside the hospital? Okay? And what do we need to tell the supervisor in that placement the student wants to learn? You understand what I mean? Challenge? So, I'll start. School meals. Do your schools provide school meals? No? Do kindergartens do? So is there something that a potential dietetic student, you shaking your head? No? Is there something that a student could observe there, could talk to the children, could find out what they're eating, could find out whether they enjoy it, could actually do a little case study on it? That would be a very interesting placement. And we would say to the teachers, we want to find, our student wants to talk to the children, wants to find out what they're eating, wants to do a little case study. And then you might like to read it, and you might like to. Can I go around my team first and then come back to you? Thank you. Yeah, so I've got one. That's my done. School. Nursery. Ethan.
I think, we're in the United States trying to expand our scope of practice and where our students happen to be in, places like grocery stores, and trying to find ways to interact with clients in the grocery store to teach them how to buy foods that are going to be healthful for them. That could be at individual grocery stores, or if you have chains of grocery stores, it'd be a possibility. Any type of food business, whether it's a grocery store or a restaurant or any place where food is served, there's an opportunity to sell the profession as nutrition experts to expand into that practice area.
Thank you. That's another one. Yeah. Now we have a new volunteer over here, Kathy.
Thank you. I haven't spoken with you yet, but I have a couple of presentations over the next couple of days. And I work in the area of food industry and have for the last 22 years, and in particular a health and wellbeing service attached to the food industry. And I guess what I can tell you is that food companies are wanting to help to position their products as healthy for people. And this morning we heard the lady say that the 3 things that people are most interested in is avoiding terrorism, well-being, and quality of life. So if we can tap into a food company's desire to help position their products as something that can support well-being and quality of life, then it can help to justify the investment that a food business might make into having a dietitian either supporting the healthiness of food products or the communication of those products, and the role of those products in an overall healthy lifestyle. Thanks.
Thank you. Okay, food industry. Ethan, you want to come back again?
No.
Okay, Karen is next.
No. Go ahead.
Well, just adding on to that, I think, working with marketing people and food companies, marketers know how to market foods, but they don't necessarily know how to market because of the nutrition value that is found in that food. So if you can couple that dietitian in training with a marketer in a food company, they can expand their type of marketing.
Yeah. No, well, I think she'll probably say, I think in many of the food company was what I was going to talk about, and I saw Kathy was here, so she's certainly the perfect person to talk about that. But they also many times have trained people in the science behind the product. It isn't just a marketer, and those people generally are trained, or part of what they want to do is talk to the professionals who are going to use the product to teach them about what the value of all that science is that developed, especially very specialized products or tube-feeding products, that kind of thing. So those companies, I have always found, when I was a dietetic educator many years ago, they were usually very warm to want to work with students and work with them to show them how to use the product in the field. So I think there's a link there, but not knowing enough about the products in your system, it's hard to...
And that's a kind of public health type thing, isn't it? A lot of public health. JeJe.
Okay, 2 things. I'm always and will be a clinical dietitian at heart, but I do have a non-hospital suggestion. What about the dialysis centers? Aren't there dialysis centers here in Romania?
Yep.
Maybe
Good.
we can get them there.
Yep.
And the second thing, this is completely not clinical, but just getting the name dietitian out there, and we have dietitians that are involved in media, television, as far as like news. In the news, sometimes they have a little segment for dietitians to come on, just to get the name dietitian out there more. I don't know if that could be a placement though for an internship, but at least Romania will also get to know dietitians too through the media. So
why not?
Yeah.
Try?
Yeah, can try.
Bert.
Another area that we have not talked about is sports nutrition. And we have just down the way here a physical therapy program. We have sports programs. We could volunteer to begin with in working with the people involved in sports. Our students at Loma have worked with the local high school football team in developing some major health habits that they did. We did 24-hour recalls to begin with, and we saw soda consumption to be so high. And the one outcome that I think we're most happy about is that we got to change them to water. And so they drank water rather than soda. And so that's something that could be advertised and piggyback with what JeJe was saying. But there's a lot of individuals who are interested in conditioning and helping, and dietitians can be very much involved in that.
And that allows the dietitian to establish their ability to talk to people, to find out what they're eating, to do an analysis of their food intake, and perhaps offer some very healthy food options and ideas. And that can then be followed up. You can go back 2 or 3 weeks later and ask, have you changed? And they'll say no, and you'll say, oh, well, why not? Don't you like my advice? And then you learn about evaluation, you learn about giving advice, and that is going to be effective elsewhere as well. Pauline has an idea, and then Jessie.
I think it's useful to use the skills that you have. And if you go back to your undergrad projects, go back to your master's projects, I think if you're innovative about those and can actually build those, go out there, find out what's happening, knock on someone's door about doing a project with them, you can then, and the lecturers can then find out if that's a useful place, and potentially because they've seen the kind of work that you do, that they then may begin to open up placements for you.
Brilliant. Thank you. Jessie.
I'm not sure of what the biggest industry in Romania is. Can anyone help me? Is there a big, besides agriculture, is there anything that is more industrial in a place where many people go to work? Pardon me?
I think States is not any different.
Okay. Okay. So, what? Okay. Pharmacists. Pharmacists. What do companies want most of? If you're running a company, what do you want? Profit and productivity. So the health of the employee is, and their productivity and their ability to come to work and be healthy and potentially decrease their costs because people are out sick, because they are 2 times what they should weigh, not so much, but potentially talking to a company about the services that a dietitian could provide, a wellness program for them. Corporate wellness, yes. And then I am a clinical dietitian to my bones too, JeJe. So outside of the hospital center, but in big clinic settings that are owned or operated by multiple physicians, physiotherapies, et cetera, as Bert said, I think would be also a nice marriage. In the United States, we're going to shut down hospitals too because they're too expensive, and the whole hope is to move that health care outside of the hospitals into those clinics in kind of a managed area. And we're struggling because we're not quite sure how that's going to work for us. But I think it's going to be around the world that we need to move some of that health care outside of those very expensive to operate kind of hospitals too.
Yeah. Okay. We have people queuing up over here to give you good ideas. So I'm going to just ask 2 more. And then I'm going to ask my very final question, and this is just going to be a quick round the go. Right, Marsha.
All right, I didn't hear all the presentations today, so let me know if I'm repeating something that's been said. But it seems to me that a lot of the new graduates have registered in the master's program. And I'm wondering if the master's program could not incorporate the practicum experience. And that is one of the models of dietetics programs in my country, that you can do your master's combined with your practicum experience. And it's easier for the coordinators of the master's programs to build the kind of projects and connections that Pauline was speaking about. So your students during that time go out and get a variety of weeks of project experience that would qualify as the practicum experience for dietetics education. And I think with most of your class in a master's program, be it business administration or clinical nutrition, that could be done. So I think that's a leaping off point that's pretty much in your own control. And there was one other area of experience that came to my mind. As I was talking to different people, I heard a story about someone who's creating new food products in the country, and you've talked about a variety of roles in business, but one that wasn't mentioned, and I think is a barrier to those who are trying to create new food products, is dietitians should know the regulations required to get a product into the market. So what's the labeling requirement? What kind of nutrients can you add, not add? What can you do? So you can see you're a very valuable resource to anyone that is trying to get their product to market. Still working with those new entrepreneurs.
Thank you. Pauline is, then I'm stopping it.
To run your own clinics. If you actually, there's a number of universities and departments of nutrition and dietetics that I know that run their own clinic. Again, they're almost partly employing one of the graduate dietitians, but it also works as helping to find places for the students that are coming through. But again, it is a work setting for the graduates that are coming out. Again, we would work as well with some of our pharmacy colleagues in the university setting, because they are bringing patients in, their students are getting that experience, and the dietitian can then also work alongside to give that advice and give dietary advice to the appropriate products.
Great. Now, just one, then you can have a final word. So I think what I'm hearing is that there are many, many opportunities here, many opportunities. You need somebody like Pauline, and I don't know whether you've done this yet, to coordinate placements. You need a coordinator, someone who does nothing but placements, especially at the very beginning, because you need to think, where are the students going to go, how long are they going to go for, and what are they going to learn when they're there. So you might have so many weeks in a clinical placement, and so many weeks in a food industry, and so many weeks in a school, but it has to be planned so that you actually get all the experiences that you need. So you need somebody, and the students need someone who knows where they're going, why they're going, and when they're going. So a coordinator of this activity is really important. And in universities, certainly in Britain, we dedicate one member of staff entirely to placements. That's all they do, because it's so important. My final question to my panel, and all they have to do is to give me one number. How many hours of placement should we think of for the Romanian dietitian? We've had many. ICD recommend 500 minimum. EFAD says 1,000 minimum. What do you think, panel, is the minimum in a place where it's difficult to find placements, but we're encouraging them? What would you say was the minimum? A week? 2 weeks? 3 weeks? 4 weeks? What do you think is the minimum? It's a challenge, isn't it? Who wants to start? Who wants to nail their colours to the mast?
So 500 hours is 3.5 months?
3.5, let's think about 1 week is perhaps 40 hours, say.
Yeah, so 176 a month times, maybe it's it's 2.5?
3 months, yeah, 12 weeks.
12 weeks. Okay.
12 weeks?
Yeah.
Jessie's going for 12 weeks? Only one number.
So ICDA came up with 500 as a minimum, looking at from none or minimal to the whole expansion. Doesn't seem like a bad place to start.
500 hours.
Yeah.
Okay.
But if I had to cut it, yeah, you might be able to do it in 2 months. But I think 500 seems reasonable if you're going to get that whole breadth.
The breadth.
If you're not, if you're going to focus, then you could probably do it later.
Okay.
Less.
But if we want to look forward and think that all the dietitians are not going to find placements in hospital, they're not going to find jobs in hospitals. They've got to go out.
Yes.
Ethan, a number, please.
500.
No, total. Total.
I'll make it 3, so 500 as well.
I think you need to clarify this is after you do the theoretical part of the stuff.
Yes. Or we integrate it. So our students do 4 weeks, 12 weeks, and another 12 weeks. So it's integrated, so they do a bit of theory, they go out. They do more theory, they go out. Because that way you can weave the theory in and out of the practice.
Can you do that in 3 years?
Yes.
Oh.
Yes.
So you don't need necessary 3 years.
No, you don't necessarily need it. You see, you have to start with what you can do, but we're talking about a minimum here. We're talking about a minimum. Okay? Yeah, Pauline? Minimum?
500 to start with.
To start with, okay.
Yep. My concern, would you accept the membership in EFAD at 500? That's my concern, because I think Romania wants to qualify as a profession, your association, and that's my concern. Otherwise, I too would probably agree with 500.
Okay.
But if it's going for 1,000, then look at how we count the hours. So if there's practical experience and projects as part of education or part of the master's, include those in your numbers. It doesn't have to be you go somewhere for 6 months.
No. And I think the thing is that we allow in EFAD, we have affiliate members, and we say they are working towards where they need to be. So if we start off with 500, then we make sure that when we get good and we have lots of placements, we creep up to 750, and then we creep up to 1,000. Right, Bert, how many hours?
I can't say.
Oh!
Because one of the things that I learned this morning is that we need to assess the knowledge of the student before they begin. I like the concept of 500 hours, but I know these students, I know some of the students anyway very well. Some of them are physicians. Do they need the same number of hours as someone who doesn't have that practice with patients and the medical profession? So just a thought.
Yeah.
So you would assess it. I'm sorry. So we did talk about that. So you'd make an assessment of what they've already had in their work life or practice, and then have an ability to add that on to that supervised practice number.
Yeah, precisely.
If EFAD would let them do that. Yeah. No, I agree with you totally.
And that's why you need the placement coordinator. You need somebody to be able to do that. JeJe, do you have a number? Ditto. Okay.
I think what Bert said is really important. Really important.
Yeah. But you have to
And
decide.
It's less scary.
Yeah.
Yeah. Than this hard number.
Those physicians won't know a kitchen very well. So That's true. So they better get some.
I think the idea of competencies really weighs in here. If a person already has established competencies in a certain area, then I think you can just check that off the list.
Okay, so the panel's recommendation is minimum 500 hours, creeping upwards, yeah? That you have a dedicated placement coordinator who actually arranges them in a coordinated way based on competencies, based on standards, so you know what the students need to meet at all stages. And that you look outside to get other experience in schools, in industry, in the media, in sport, and you look at creative ways alongside nurses, alongside doctors, alongside physios, maybe, and you also draw on your dietitians who have graduated, or members of staff who can go into the hospital, whatever it might be. So there are lots of ways there of creating practical experience for dietitians. Now, somebody wanted a question.
Noi în universitatea noastră avem prevăzut deja un minim de 500 de ore.
In ours here?
Timișoara.
In Timișoara University they have.
Problema este calitatea acestor ore de practică.
They want to see the quality of their
și cunoștințele care le
teaching and
putem
practices
dobândi în aceste ore și cine ne supraveghează și ne verifică în practica aceasta e problema.
Already says that the student should have 500 hours of practice, but it's not the same thing. It's about the practice that you are doing during your fellowship, during the time you are a student. It's not the same thing with gathering experience after you have the knowledge, after you graduated, or at least in the third year. I would not count the experience that you gather in the first 2 years of your school, because I think you don't have the knowledge. I don't think you can plan for a nutritional plan for some diseases if you did.
But think more creatively. Dietitians don't just work with people with illness. We work with others. So going into the industry or going into schools, they can be done early.
Then there should be a plan what you can do in your first years and what you can do afterwards.
Yes. And that is the role of the coordinator. And
in the
that
first
is the
you
role.
Can do healthy people, you can do industry, you can
absolutely. And that's the role of the coordinator and the competencies, building up. And remember, the competencies are things to do with ethics. Ethics are not just important in a hospital. They're important when you work with little children as well. So you can practice all of that in different places, but you need it planned. You must have it planned, you must know what your standards are, and you must meet them then, and that's why you need a coordinator.
So it's not only by meeting those for 500 hours, but it's also by keeping a schedule.
In your first year, you can speak about food, you can speak with healthy people, they're not ill. You can speak with, make some workshop with them, because somebody, I'm in a private practice. Most of my patients are not ill. They come to see me and to have a healthy diet, or to adapt the diet to the sport, or to adapt the diet to the conditions, but they are not ill at all. So you can do this in the first year. Some workshop, for example, with children at school. What is the food, how it smells, how you can eat, how, because often children don't eat because they don't know the food. So you can help them in your first year.
Okay, so is that helpful, audience? Yes, we have. Yes, I'm coming to you. Can we just? Yes. Do you want to ask a question or make a comment?
Make a comment. I work I volunteer in a kindergarten. I teach nutrition to children ages 5 to 7, and for almost a year, once a week, I meet them for 20 minutes to 40 minutes. And they know that I will graduate this faculty. I offered my services for meal plans for everything else they need, but they didn't ask yet. Still the nurse is doing the meal plan, and the nurse just graduated the sanitary, high school. The high school, so I'm thinking who's more qualified to do the meal plan, yeah? And still I volunteer. I don't ask money for that, yeah? But everything that you said is great, but in the end of the day, I still need to feed my daughter and my husband. You know, I can volunteer because I do this with passion, but I still want money, you know? I don't want to lose my passion because of the money, but I still need some money, you know? And it's hard to get money as the
I think this is a very common problem, I'm afraid to say, and it's growing. But this is what your association can help with, because here we're talking about employment for dietitians. And this is where your association can help to promote dietitians and what they can do, and what the difference is between a nurse and a dietitian, and so on and so on and so on. So I agree with you, but that is another agenda. Okay?
My colleague, she's a physician. She graduated the University of Medicine. She's working also in a kindergarten as a doctor, but was also never asked by the owner of the kindergarten, it's a private kindergarten, to help with the meal plan. Why is that? Because she will change into healthy food, yeah? And this costs, and she wants to feed the children the low-cost meal plans, yeah, which is not good.
Yeah, low cost is not necessarily not nutritious, of course. It can be done like that, but I understand the problem. Okay.
I think a little bit it's a misunderstanding what's going on. She complains that both of them were not asked to do a job that is not still available in Romania. So it's not a surprise that I'm not asked to do something that we are not used to do. The person in the kindergarten probably does not really know what a dietitian is. How does it work? What does it do? So I don't think we should complain about. And sure, it's a start. It won't be easy, and we have to do a lot of steps. But if the first person will be starting to work as a dietitian, it will be easier. So I don't think it's a surprise that the kindergarten does not hire it.
May I say a few words? Well, first suggestion is, I would like to see who volunteers for a sabbatical in Romania from this group. They are great at generating ideas, and they not only had ideas, but I guess they made a difference in their world. That means that they put to work their ideas. Secondly, tomorrow I will have a presentation about a program which we started here in Târgu Mureș, meant to highlight what dietitian can do for their community. But that means work. I mean, everything which we discuss here means work, and maybe not so paid like we expected, but those who have passion and who will stay with the association, I think in five years they will see that this profession will be paid and will be needed. So tomorrow I will say more about this, and what we've done here in Târgu Mureș and what we plan to do can be replicated very easily in Timișoara, in the other universities who want to participate. And so instead of doing only in Târgu Mureș, it can be done in Timișoara, and it can have an impact so that in a few years everybody in Romania will know what a dietitian means and why they are needed.
If I can give you some advice. It's a good way to volunteer, but you must stop, because if you do it for free, where is the need to pay for a dietitian? Yeah, yeah, but yes, to be known, but after sometimes 1 week or 1 month, you stop. It's the same for soccer, football. You have many big amount of money, no dietitians. Okay?
Yeah, it's absolutely true, because otherwise they think they get it for nothing and they don't value it. But I think it is a case, and it is very interesting that one of the influences of putting dietitians into placements in the food industry, into placements in schools, you have to talk to the supervisors, because they have to agree to have the student with them. And when you talk to the supervisors, you say, my student wants to know about this and this and this, and they will write a report on this and this. And suddenly, the supervisor begins to understand what dietitians do, because they are being asked to supervise a dietetic student. So they have to know something about that. And when you give them back the report, they will find that it is very interesting for them to read. So actually we can use placements to promote what dietitians can do. And actually that is very, very good advertisement. So that's another reason to have well-coordinated placements. Yes. Right. Now, is there anyone else that would like to add anything to this debate before I pass the microphone to anyone else who's already spoken? Oh, small articles and put them into the magazines or newspapers or whatever. Is there a... Yeah. Okay. Anyone else? Are you happy with what we've been talking about? Yes? Is there anyone who's not happy and wants to tell me? Is there anyone who thinks we haven't kind of covered everything yet?
The gentleman.
I know that. I'm coming up slowly. Because I'm going to ask you to be positive, please. Positive.
Yeah, I am positive because I want to tell you the reality. First of all, to tell you something about my life. I studied about 3 years nutrition in Hungary in 94, 96, 95, 96 with a dear American teacher. He was an MD and a nutritionist, a very nice man. I graduated there, but the Hungarian government and the Romanian government, they didn't recognize my diploma. And after this, I worked in media for 10 years, making thousands of programs. My thesis was shown there in about 8 country districts in Romania. And I work in health programs, invited physicians to the TV station, asking questions about nutrition and everything, making cooking class, teaching the people how to eat healthy according with the last nutrition statements. And finally, everybody say you are not a nutrition. Now I started to be a nutrition to Timișoara, and I'm in the first class there. But now I came to the question, it's only one word. But before I say some more sentence. And now I want to be positive. But not all the ways to be positive means to tell the positive things. You should be positive, telling the reality. And now, for which reason I press to speak? I saw many times the children coming from the kindergarten. They are fatter and fatter and fatter, overweight day by day, and nobody said anything. The recommendation of the European community is to give fruits to the little kids. The power in economy, they give raffinated carbohydrates, and I don't know which kind of fats, not fruits, because the fruits are not expensive. You don't earn much money with the fruits because everybody has in the garden, and they are with a low price. Even the bananas are coming from Costa Rica or Ecuador, they are lower priced. And they don't have money. And for this, they give bad things to the little kids. And nobody is saying anything, even the physician or the government, everybody. Some person, they started to speak and tried to make something, but they don't have the... And my question is, who is and who will start? Because we have many recommendations, but we don't have even I don't know, even if you want to make something, not for the money, because in all my activity I didn't receive money, but you cannot make something for your children, for your father who is dying because of the kidneys, because of prescription or bad prescriptions. They died, they have atherosclerosis, they have all kinds of sickness. Who will be? This is the question. Thank you very much, and excuse myself.
You need to go on a placement. You need to go into the food industry, and you need to get into the marketing department, and you need to find out how they manage to persuade all the populations to eat foods which do not benefit their health. Because what we have to learn as dietitians is how to market and how to sell our healthy recommendations. And we somehow sometimes just think because we know, because it's the right thing, because it will produce, we have the evidence, we think somehow people should listen to us. But you know, I once gave a radio interview. They wanted to interview me for a piece in a magazine, and I said, well, yeah, you know, good, healthy food, well, plenty of fruit and veg. Just a minute, she said, that's old news. I don't want to hear that. Haven't you got anything new to say? And I said, no, because actually it's not happening yet. And we have to learn how to sell those messages. And the place to learn is, I would beg you to know, in the food industry, because they are experts at it. We really need to find that out. So that would be the placement I would recommend for you. Seriously. And when, you know, seriously, we need to know how to write. We need to know who to lobby. We need to know where to go. We need to know how to present our cases. We need to learn that, and that's another part of the training of a dietitian for the 21st century. It's no good hiding, knowing we have the answer if we don't know how to persuade people. So, I'm going to finish now. I'm looking around the audience and I'm not seeing anyone wishing to say anything. Okay. So this is the end of the second day. Oh, now someone wants to say something. Okay. The last word then.
I have a little experience also in industrial medicine, because I am, by fortune, also an enterprise doctor. And I have a competence in that. As a general practitioner, I had the opportunity to have this. And I have several industry departments where I work as a doctor. And I faced with the situation that they said last time, we can't pay so much for that. We would like to work with you in the future, but we have so many other doctors coming and proposing their services more cheap than yours. So they will lower the prices. And when I will go to them, because they are also alimentary industry beside, and I will go and I will say, now I can provide you also my knowledge in food industry. They will say, oh, we just negotiated that you will work at a lower price. So what do you suggest me to do?
Okay. I haven't a clue. I'm very sorry. I know. But it's the same situation. You see, it's that you have sometimes to be very brave, because you have to say to yourself, I am worth more than that. And once we start undervaluing ourselves, everyone else will agree with us. You remember what Jessie said this morning? Confidence is really important, and it's hard. So you have to make a decision. Are you going to say, I'm actually worth more than that? I am. I can bring this, 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 and this, and I can make a difference to you. And you have to agree, you have to realize that. I think you have to make sure that you don't undervalue. And it's very interesting in many cases where you actually are standing up and saying, I am worth this. They don't back down. They say, yeah, okay. We understand. So it's worth trying. Last word? You sure? Promise. I have a promise.
I have another job opportunity, maybe to take into consideration. Working in a university, I believe that the future graduates, maybe not starting the first 1 or 2 or 3 years, but they should be the one teaching nutrition to students, not physicians or I don't know what's the situation in other countries, but this is what I believe, that we should be the next teachers.
In many countries, it is only dietitians that teach other dietitians, but we do research too. Yeah? Yeah, okay. Right, I'll try again. This is the end of the second day. And I think we've had a very, very good day. We've had a lot of discussion. We've shared a lot of ideas. And it can only get better. Stay confident. Think visionary. Thank you.